Hey, how's it going?
Good. Just
Can,
that's a
can you hear me?
mm-hmm.
Okay, good. Wow,
So,
it's a miracle. Probably start to let stuff or let people in here in just a second.
okay.
I'll let some of the organizing partners in just to check in. Perfect. Hi, Sarah.
Hello.
Good morning, afternoon. Happy Monday.
Mhm.
Okay, looks like we've got 6 in the waiting room. We'll let those folks in just a sec.
Right.
Sarah, you remember Diana Korea from the kickoff?
Mm-hmm.
Awesome.
Hi, Diana. Hi, how are you? Good.
Thought maybe we'd catch Steve before we get started, but we may just go ahead and let folks in. Yeah, it's 1, so I'll go ahead and do that. We'll just do any housekeeping once we get going. Good afternoon, folks.
No
Diana, if others come to the waiting room, would you mind just
water.
helping me let them in? Thank you. Awesome. Well, we've got 101. We'll get started in just a couple of minutes. I'm Ty Kane with Wichita State University. My colleague Diana Korea is here with me.
Okay. You have water like in a bottle in your classroom? Yeah.
Let's see. Looks like we've got at least one AI reader with us today, and we're recording today's call, just FYI. Y'all should have seen that pop up when you joined. We'll pause for just a couple of minutes while other folks join. While we're waiting, just another minute or two for others to join, if you wouldn't mind, in a few minutes, we're going to be doing some introductions via chat. And so I'm going to ask folks to just enter their name and organization or community name in the chat. That'll give Diana and I a chance to copy paste that info into the meeting notes for today. So again, if you wouldn't mind just getting ready to do that, or feel free to go ahead and do that. Just drop your name and organization and or community in the chat. And then on your screen name, it'd be nice to know who you are as well, first and last name. So if you wouldn't mind, we'd love to see first and last name and possibly even organization if you'd be willing to do that. I'll do that myself in the chat. Thanks, David. Good to see you again. Sarah, thank you for being here. Yadira, hopefully I'm saying that correctly. And Ivy, Daniel, Audra. Good to see everyone. Bonnie, hi there. Awesome. All right. Well, appreciate everybody taking a minute to do that. A couple of other housekeeping items. We'll go through the agenda in just a minute. But I will just say that in a minute or two, I'm going to upload a couple of files to the chat. And I would just encourage you, especially if you're working on a laptop or a desktop that allows you to have multiple views, just to keep those files handy. One is going to be a copy of the draft action plan for this priority area. And the other file will be some meeting notes from the CHIP kickoff that we had last week. And so those are just a couple of different resources for you to reference throughout our discussions today. So I'm actually going to go ahead and upload those files to the chat. And in the meantime, If you're just joining, I was asking folks that joined at 1 to just put your name and organization and or community in the chat, just so that we know who is with us today. And next, I'm going to go ahead and upload that action plan. Okay, so what I'm putting in the chat now is a copy of the draft action plan for substance use and misuse. Again, just a resource for you to review throughout our discussion today. And the second file is from the CHIP kickoff. And these are notes from the discussion that we had about substance use and misuse. So just wanted to make those available today. And you should now see 2 different files in the chat. So Lacey, thanks for joining. Appreciate you typing your name and info in the chat. And I mentioned before, I'm Ty Kane, and I'm with Diana Correa from Wichita State University Community Engagement Institute. And a big thanks to everybody for joining today. This is the 3rd out of 4 Cowley County CHIP priority meetings. We had 2 meetings last week, both well attended. And we've got the call today, as well as the call on housing priority tomorrow. I will just mention, although you saw the prompt when you entered the room, we are recording today's call. We had a request from at least 1 community partner, so they could review that while they were not able to participate live today. It looks like there's also at least 1 AI recorder in the room, which is a note-taking software that just captures written notes from today's call. Awesome. Well, again, appreciate everybody dropping their info in the chat so we know who's in the room. I'm going to provide just a brief overview of today's agenda, and then we will get started. And I see that we have a few folks from our Cowley County CHIP planning team on. I see Sarah Johnson from William Newton Hospital. I also see Steve Denny, who is serving as our priority lead for substance use and misuse area. And I'll say a bit more about that role in just a minute. And Steve, I'll pitch to you in just a few minutes to do kind of a walkthrough of the CHIP goals that have been identified so far. And appreciate you being with us here today and all the work you did ahead of time put into that action plan development and recruiting additional voices to be here and at future meetings. Okay, so in terms of the agenda, it's Monday. I have thought about a lot of things since I last thought about the Cowley County CHIP, and so I'm guessing you all have too. We're going to spend about 10 minutes with a discussion just to really help us shift our focus to this topic for today. And so again, we'll spend about 10 minutes on that. From there, we've got between 25 and 35 minutes per goal area to have an action planning discussion. And so first thing is we'll check in on the current goals. We'll ask whether any of those need to be adjusted for clarity, for comprehensiveness. We'll also ask if additional goals are needed. And so that conversation will be coming up. We're going to wrap up our day with 2 other important discussions. One will be about measures. Many of us in this room are probably not strangers to action plans and all know the importance of developing measures so that we can understand and document the type of impact that we make. And then finally, we want to have a conversation about implementation and monitoring. So right now we're in the Community Health Improvement Plan, Action Plan development part of our work. And soon this CHIP will be implemented. And so when we move into implementation and monitoring, we need to have a clear sense of what coordination and collaboration will look like, how we'll track progress, how we'll check in with each other to keep momentum going, how we'll hold ourselves and others accountable for continued progress on the work. So we'll do a quick why discussion, we'll check in on those goals, discuss action plans, and then wrap up our time today with measures and implementation and monitoring. And about at the halfway point, we'll take a 5-minute break just to give folks a chance to move around and take a pause from this work. So let's go ahead and move into that why discussion. And so I'm going to ask Diana, if you wouldn't mind sharing your screen. I think you've got those discussion questions up and ready to go. Yeah, perfect. Thank you. So again, substance use and misuse were identified through the Cowley County 2024 Community Health Needs Assessment as one of 4 priorities. Let's just wrap our heads around this for a minute. I would love it if you would come off mute, use your voice. You're also welcome to type in the chat. Why is this a priority now? And what data or experiences tell us that?
You want me to speak a little bit to our experience, Ty, or do you want me to wait to hear
No,
feedback from the group? Because
that'd be great, Steve. Yeah.
I can talk a little bit about maybe what we know and what we don't know. One of the things that we did simultaneously as this needs assessment was going on just for Cowley County is we did a 5-county regional needs assessment, which wasn't nearly as detailed and focused as the Cowley County one, but we found very similar concerns. Substance use and misuse was a theme in all of our counties in our region, really specifically concerns about methamphetamine, growing concerns about opioids, and still traditional substances, alcohol. If we look at our emissions, typically there's 3 top substances that kind of interchange. Alcohol, methamphetamine, and marijuana are the top 3 reasons that people come to care. But like I said, opioids is starting to grow and be more frequently a concern as it's intermixed with other substances as well. So that's been pretty consistent. And specifically what came up on our needs assessment is that substance use, parental substance use with young children in the home and the impact that has on our communities, schools, foster care system, all of the other programs there. So that's something we do know. It is definitely a concern, a growing concern. And one of the things that we are trying to assess is capacity, and is it a lack of provider issue, or is it more of a community need that we need to address from a more health and wellness perspective? And one of the things we like to track is reasons. When someone comes in and has an admission, is what are the reasons you're using? And there's usually 2 or 3 common themes. One is some unresolved mental health issue, depression, trauma, loss. And some people use substances, quite honestly, to cope as a way, alternative to prescription medications. Believe it or not, there's a lot of people who use methamphetamine kind of as an alternative to Ritalin or other stimulants. So we do encounter that. So, but usually there's some sort of unmet need driving that, which ties to other social determinants of health that we need to continue to assess and evaluate. One of the other areas that I would just add is that the vast majority of people we see for treatment, and I think most larger providers in our state see are here because they're court ordered or they're asked to be here by someone or made to be here by someone. I'd like to see better engagement around voluntary care and treatment. And so, that's just a few thoughts to throw out there. This is not limited to Cowley County, where we saw very similar data in our other 5 counties, including the next door neighbors at Chautauqua, Montgomery, Wilson, and Elks. I'll throw that out there and stop.
Thanks, Steve. I really appreciate those thoughts. So right now, again, just kind of having a conversation to shift our thinking back to this topic from probably many other competing priorities that we've been focused on over the weekend and today. So we'd just love to hear your thoughts. Why is this a priority now, substance use and misuse? And what data or experiences tell you that?
Hey, hi, I'm Ivy with Angels in the Attic here in Arc City. Can you hear me okay?
Yeah, sure can. Thank you for being here.
We serve a lot of the homeless that are down here, and a majority of the homeless that we have come in here seeking food and assistance are battling with addiction. I agree that some of it, I think they are self-medicating to treat other issues, as we have seen them go into treatment and get their need met and came back and was awesome here in our community. But we have a lot of them that are battling, and it's fentanyl, it is methamphetamine, that's very strong on our streets here. That's one of the addiction things there. And we also work a lot with the ones that are coming out of treatment in PFH here. We work with them reestablishing, trying to get them to be able to make it to and from court cases, to and from probation hearings, to and from a lot of the drug court programs they have to be in. If they live in the Arc City area and they don't have transportation, I mean, we've had them riding bicycles in snowstorms trying to make it to meetings on time. And a lot of them fall off of the program because it is kind of hard to get.
Ivy, I'm so sorry. I accidentally clicked on mute as you were talking. Would you mind unmuting yourself? And I apologize for that. I heard some background noise from another line.
There you go. But we've noticed that too with them. It's hard for them to get to and from some of the meetings. So if we could establish something for those that move into the southern part of the county to be able to make it transportation or something to and from. We've had a lot that have relapsed or been pulled back to do a dip, as they put it, because they were late for a lot of their programs trying to get to and from. The Second Chance group down here in Arc City works wonderful with a lot of our people that are in recovery through here. But that is one of the biggest things I see is it's the reason why it's so predominant now. It's everywhere. It's literally, we have people in empty buildings, we have people under bridges, we have people in empty houses, and a lot of people have no idea just how many there is.
Thanks a lot for sharing that. It was really helpful to hear some of the things that you're seeing, that you're kind of talk about your organization's role in this work, and pointed out some needs as well as some opportunities for possible, warm handoffs, or even an idea we're talking about with this chip is around, we're calling it resource coordination or optimization. So thanks so much for sharing those ideas. Anyone else? Would love to hear from a few other folks if you would be willing to come off of mute and share your perspective. Again, why is this a priority now? What data and experiences tell you that?
I would like to speak to kind of why this was selected as one of our top areas of health concern. The past 2 years for the community health, not 2 years, 2 cycles for the community health needs assessment, mental and behavioral health has been the top priority that came out of our needs assessment. And so this one was differently approached as far as how we collected the data, but it definitely was a chief concern. But another reason why we identified this priority is because there's already some momentum built partially because of the work that's been done in the past. The Cowley Acts group, the healthcare group, is focusing on substance use and misuse. And so we felt that that we could build upon what's already being done within the community with this effort.
Thank you, Sarah. Any others willing to come off mute and share? I would love to hear a little bit more about what brings you here today, specific to this priority, and what is a priority for you and your organization now, and why do you feel those issues need dealt with in the community or addressed in the community?
I mean, from the hospital side, the reason that I'm here is to learn more about the issues and the things that are identified and the ways that we're working to try to address some of those things. I mean, we see a number of people coming in through our emergency department, especially for drug-related events. I don't have an exact number for what that is to provide to everybody, but any way that we can try to help cut down on that is a huge thing. And obviously, as a parent with several teenagers and another young child, ways that we can try to address that to make sure that the youth in our community are supported and not led into any future issues related to drugs and substance abuse.
Great, Brian. Thank you. It's encouraging to hear as folks have shared kind of the connection to some of the goals that have been identified related to accessing resources, support for people in recovery, and then there's a focus on prevention efforts in schools. So it's cool to see that connection as folks are speaking up.
Hi, I might add something as a district nurse in Arc City. I'm not at the high school level, but I know it's a concern, like just educating students, like, you see fentanyl overdoses all over the world and country and how people are dying, not even knowing they're taking a substance that could potentially have that, effect on them. Just mainly educating and letting students know, like, how serious taking a substance is.
Yeah, thank you, Lacey. I appreciate you sharing that perspective as well. Well, I'll pause. Maybe have time for one or two more folks if you'd like to jump in. We'd love to hear from you.
So I'm from Child Start, and from my standpoint, kind of coming to these meetings is kind of more informative to us since we work with a lot of providers and a lot of parents in the community, and we work primarily with lower income families. And not saying that it's only towards lower income families that this happens, but we do see a lot of substance abuse in lower income family households. So just trying to get a better perspective as far as informing the community that we serve and we work with.
Yeah, thanks for sharing that. Thank you. Very good. Well, hey, let's keep moving forward. There will be many more opportunities for you to share perspective and ideas as we work through today's agenda. So like I said, we wanted to get started with that why discussion just to kind of shift our thinking to this topic for today. We're going to move now into a discussion around goals. So specifically the three goals that have been identified in the draft action plan for substance use and misuse. So keep in mind, these plans have been developed really just between now and when the 2024 CHNA, the needs assessment, was completed. A core CHIP planning team has been staffed from William Newton Hospital and City Cowley County Health Department. We've recruited a priority lead for each CHIP area, and that group has worked together to draft action plans. Each action plan had goals and objectives and some activities listed, and those were shared out at last week's kickoff. And so today we'll have a chance to really dig into the work that's been done related to this action plan. I'm going to go ahead and do a quick screen share. And I want to show you, this is the CHIP action plan that I put in the chat just a few minutes ago. So you're welcome to pull this up for yourself as well. Just want to point to a few key definitions and a couple of important items. So today our work is mostly going to be happening at the goal level, and then we'll also be having a discussion a bit later, really at the strategy level. And so when we think about goals, we want to think about broad long-term aims that relate to this health priority. So you'll see more in a minute about what I mean. It's broad enough that a lot of different objectives and strategies can fit within it, yet it's specific enough that leaders, policymakers, community members can get a pretty clear sense of what that work entails by the goal statement. As a reminder, we have 4 health priorities for this CHIP. We also have identified 2 cross-cutting factors. These are underlying issues that in some communities obviously could be separate CHIP priorities, but the planning team thought it would make good sense to include these as cross-cutting factors. So what that means is that we believe both transportation and resource coordination are issues where progress can be made as we develop CHIP plans related to the 4 CHIP priorities. So as we're talking today, please have, top of mind that we also want to hear your perspectives as it relates specifically to transportation and resource coordination as either gaps or opportunities in this work. And with that, Steve, if you wouldn't mind, we don't need to get too deep into the activities, but I think it would be really nice if you could provide a flyover of the goals and objectives and maybe just a brief summary of the strategies that have been identified. I'll keep the screen share going just so folks can see while you're talking.
Absolutely. Thank you, Ty. So the first goal is about making SUD, substance use treatment and recovery services, easier to access, and reducing use and misuse in the community. And I would say harmful use and misuse is probably the intent of that goal. There was some of the strategies which were previously identified. One is about availability of both inpatient resources, co-occurring or mental health dual diagnosing resources, and just in generally increasing the availability of providers. We have a goal around a strategy around increasing medication-assisted treatment, which is what MAT stands for. And as far as the activities, what we've discussed at this point is not as much about finding more providers or finding funding for additional providers, but more about just taking an inventory of what we do have available, both in Cowley County and within the region. So you'll see some activities around identifying who's available, what's the current available provider network, and making sure that the resources that are available are well known. And as a SUD provider, it's not uncommon for people to not be aware that we have those services available. We have multiple co-occurring counselors. I've encountered a lot of people in Cowley County that do not know that there is an inpatient provider in Cowley County, Preferred Family Health Services. So making sure that the community has a good understanding and we're communicating those resources, and not just those 2 providers, anyone in the community, private practitioners, support groups such as AA, NA, faith-based groups. It's really important to make sure that as a community, we're getting those resources out there. And another tool that's available is peer services, which is individuals in recovery who go back to work in the system and are available as well. So that is one strategy. The second one is strengthening community support for people in recovery. And the first objective is to increase access to services. We did talk a little bit about what do we do for individuals who don't have the ability to pay, who don't have insurance, who are not on Medicaid. There are state-funded services, we call it the block grant, that are available throughout the state. That is a predetermined pot of money that is distributed to some providers throughout the state of Kansas, both inpatient and outpatient. A lot of people don't know that that's available, but those services are set up on a sliding scale fee, and it pays for a variety of things: outpatient services, peer services, inpatient residential services. But that could be another strategy, is making sure that the community is aware of what is available out there and in the region. A lot of people don't know there is an inpatient facility for women in Sedan, Kansas, which is your neighbor next door over in Chautauqua County. So those are some other things we can talk about. The second strategy that was identified is identifying the amount of individuals that come into care voluntarily versus mandated through the court systems. And one of the things that we thought might be helpful is to get an idea from the existing providers of what percentage of your admissions are here because they have to be, or those that seek services on their own. And I think particularly if I suspect we're going to see at least 90-10, maybe I'm overestimating. 90% of admissions would be mandated and 10% or less would be voluntary. Maybe that would help us understand what gaps or what needs are not being met in the community, including, where we need to message and get those messages out. And addiction it crosses all thresholds, all income thresholds, and making sure that our community is fully aware of that. And I believe the next objective, we talked about identifying and reducing demand, supply of illicit substances in Cowley County. I think any conversation about illegal substances that are available in our region, meth, fentanyl, we do have to talk about supply, demand, and how readily available it is. How cheap is it, right? The more accessible any substance is throughout history, the more people are going to use it. So that's more of a community-wide strategy. You have to be involved with law enforcement and even state authorities sometimes in those conversations. But we thought it would be important to include that just because of the nature of how substances work. And by the way, I do think we haven't talked about this, but particularly in the schools, tobacco use, vaping is still a substance that has harmful impacts on our communities in terms of health and health outcomes, ER utilization, chronic diseases, those sorts of things. And last, there was a goal around increasing substance use prevention efforts in schools. So there was a strategy of expanding training for school staff. We thought it would be important to identify what types of trainings are really needed and would be really useful and shown to have outcomes. There's a lot of prevention models out there that have proven not to be all that effective, that are still hanging around. There's others that are more effective. And then there was a goal around school-based education. Once again, figuring out what do teachers, staff, students need to be successful in all the different districts. And we certainly don't want to leave out our smaller districts in Cowley County as well. And there was goals around strengthening partnerships, community-based organizations, making sure we know how to talk to each other, making sure when possible that we're using the KCTC, which is the Kansas Community That Cares Survey, to get accurate information about what's going on in our schools. There's some really good data in those surveys. And finally, there is an opportunity for grant services, grant-funded mental health services through the Mental Health Intervention Treatment Youth Grant, and those dollars are available to both organizational providers such as ourselves, but other providers can access those funding. But that is a grant that goes through the school district. School districts can apply to get funding, and that provides staff within the school to be able to do screening and referral for mental health, but it also helps bring in providers to the school, because often our children we see in need of care have parents who are not as engaged, or maybe who can't get their kids to treatment for whatever reason. That's a good opportunity there in Cowley County that we could be expanding. And we're currently doing that in Burden, and I believe to a small degree in Udall already. And so there could be some opportunities for providers to be involved in that. So is that what you're looking for, Ty? Anything else I missed or need to cover?
That's really helpful. Yeah, thanks, Steve. Appreciate that walkthrough. So, yeah, perfect. Everybody should have access to the action plan, the draft action plan through the chat. If you can't find it there, let me know. I can re-upload that. And again, just as a reminder, we're beginning this conversation to review and discuss the action plan goals. Before we get there, before we start to dig into the 3 goals that have been identified, we did want to check in with this group and get an understanding of how do you feel about these goals? We'd love to hear any questions or feedback that you have, any initial reactions that you have about these goals. Do they capture what's most important? Or is there anything that's still missing? So feel free to come off mute. Feel free to use the chat, and we'll capture the feedback that you provide. So what are any initial reactions to these goals? Any questions? Does anything just not make sense? Is it a bit fuzzy, needs clarified? And then also, in your opinion, do these 3 broad goals capture what's most important now, or is there something that's still missing? I can tell you from the previous 2 Cowley CHIP action plan discussions around food and nutrition, and then around healthcare access last week. We did end up adding one or two goals for each discussion. So if you do feel like something's still missing, would love to hear any proposed ideas about what that might entail. Not hearing much feedback. Steve, I know that you were very involved in working with the CHIP planning team to go through not only the community health needs assessment, but also just kind of think about current opportunities and challenges to map this out. Do you have any questions? I mean, as you kind of made sense of trying to organize these goals and objectives and ideas, are there any specific areas where you might want some feedback from folks in this room?
I think one of the biggest questions I would have is what voices are not in this conversation that should be? Who should we be hearing from that could give us valuable direction and insight into this issue? Maybe outside the provider network or the healthcare network, people that have direct. I think what Ivy was saying was really important yesterday. What's it like on the ground level, and how can we have a better understanding of what truly the needs are, so we can have a better idea of how to close those gaps. So who are those voices? That's a KLC thing, engage unusual voices. So that's something I think would be important.
Yeah, Yadira is saying other mental health professionals is a voice we need to continue to have included in this process. Yasmin, hi, Yasmin, says NAMI, specifically Amy from NAMI. Yeah, thanks, Steve.
When we work with them that are in treatment there, when they first get there, and they come from all over the state, a lot of them don't have funding for prescriptions and stuff, and we have helped with that, or clothing, or they get there fresh out of jail and they don't have clothing. We help provide that. But once they go through the treatment and they're out here, finding housing for them, helping them find jobs out here, helping them get household items and getting set back up, as you know, while they're trying to pay fines and pay restitutions. And if they've got their children, to get their children back in the home, it's kind of a daunting task. And they try to go through one thing at a time. And it can be a little bit overwhelming trying to get all of it, to meet it all. So finding support additionally for funds to help with rent, or even jobs that will take them or help find driver's license and social security numbers and birth certificates. There's a lot of different areas that they come up against face to face as they come out here trying to prepare to go to work.
Yeah, that's great. I really want to hear more about ideas there when we dig into I think it's goal 2 around strengthen community support for people in recovery. I think you may have some additional ideas to share as we dig in. Thanks. Really good, important information for you to share. Thanks for that. We just had another participant join, so welcome, Gary. Glad that you're here. If you wouldn't mind in the chat, just letting us know who you are and the organization or community that you're with. I think we had a couple of other folks join just during that last discussion as well. So if you've not yet dropped your name and organization and or community in the chat, please do that. We look forward to hearing from you as we move the discussion forward. Any final thoughts on the goals before we move into a deeper dive and get more feedback from you to inform action plan development? Any other initial reactions to these goals that you'd like to share out? All right, one more question on this topic. Diana, if you wouldn't mind just scrolling down to that final question on goals. Yeah, here we go. So are there any additional goals we should consider? So just point blank, is anything missing that should be added that doesn't fit into these 3 identified goals? All right, well, let's move on. Diana, I'm going to go ahead and begin a screen share here in just a second. Thanks for taking those notes. Nice work. So again, let's shift into some action plan reviews. So we're going to dig into Zoom Whiteboard. I'll bring that up with my screen share here in just a minute. And as a reminder, we have 3 goals that we want to discuss. Conversations on each goal could honestly last anywhere between 15 to 35 minutes. We'll work through one by one. We have 4 different discussion questions for each. You'll have a chance to use the Zoom Whiteboard sticky notes to add your ideas. And so I'll bring that up now. I will tell you that probably around the top of the hour or right after we've moved out of discussion on goal 1, we'll take a 5-minute break just to stretch our legs and do a quick reset. But for now, let me grab that whiteboard. Okay. So here we are. Let me grab the whiteboard for goal 1. So here we are, just a quick little bit of housekeeping on the Zoom whiteboard. If you were in our Cowley chip kickoff last week, you're no stranger to this tool. There's a couple things I want to draw your attention to. First, there's the grab tool. That's the little hand in the bottom right-hand corner. If you click on grab, you can kind of navigate yourself around the board just by clicking and dragging. There's also the select tool, which is this arrow icon. And by selecting the arrow icon, that's where you're actually able to highlight one of the sticky notes and just type in it. So you can grab a sticky note, pull it up, double click, and you can start to type any ideas that you might have. So that's the quick housekeeping there, quick training. I'll tell you, if you're on an iPhone or on a small device that may be difficult for you to see and engage in that way, you're welcome to just type in the chat. You're also welcome to come off mute and talk, and Diana or I can capture your feedback on a sticky note. So we want you to be able to participate whether you can use those sticky notes or not. So here's the plan. We're going to focus first on goal 1, make substance use treatment and recovery services easier to access. We're going to talk about 4 different questions. We're going to start with what's happening now. The next question will relate to what needs to happen, who needs to be involved, and then what do we still need to learn. So here's the thing. This is the big purpose for today is we've got a lot of different voices in this space. We want to get as many different ideas and perspectives as we can get. We'll take the feedback and we'll make adjustments to the action plans based on today's feedback. From there, we'll have the community meetings in late March, one in Arc City, one in Winfield, where community members, all of us will have another chance to review these CHIP action plans. So instead of wordsmithing the action plan together today, we're framing the discussion around these 4 questions to get feedback. So here we go. Goal 1, make substance use treatment and recovery services easier to access. So the question now is what's happening now? So let's focus on this question for just a couple of minutes. What is happening now? Feel free to grab a sticky note, type those ideas in. So if you're familiar with a program, a strategy, if you're familiar with different types of treatment providers in the community, would love to see it. We want to see a picture of what's happening in the community now as it relates to substance use treatment and recovery services. Yeah, let's see. I was looking at the chat. Steve stepped out for a second. Yeah, Yasmin, thanks for the reminder about, oh, I'm sorry. Yadira mentioned that too, Yasmin. Thank you. So from your perspective, what do you see? I know we have school, district staff, we have hospital, we have a community health center. I believe we have a couple of treatment providers in our space today. If each of you could pull, to the front of your mind, one or two ideas, drop those in the chat about what's happening now. We really would like to see a broad picture of what you see. What do you see in schools? What does substance use treatment and recovery services look like in the schools? Are there referrals? What are you seeing in the hospital? What does a warm handoff look like? What programs and services might be available at the community mental health center or community health center? Excellent. Yeah. AA and NA Oxford House ACT team at Fort County. Thanks so much. I see Hope Project. I see Keeping ICT Safe, a substance abuse prevention program in Sedgwick. Yeah, please keep those ideas coming. If everybody could drop one or two items there, that'll help us get a real clear sense of what's happening now. And again, feel free to come off mute, call those ideas out. See Cowley Axe mentioned again here. Very good. PF, okay, yeah, preferred health, got it. Yeah, good stuff. Hey, as we're continuing to map out what's happening now, let's go ahead and also jump over to what needs to happen. So as you think about what it's going to take to make progress related to this goal, make substance use treatment and recovery services easier to access, what else needs to happen that's not happening now? Please add those ideas in the chat or grab a sticky note and add them that way. So again, when you think about the organization you represent, when you think about the people in your community with needs, stakeholders in this work, what are the types of things that need to happen in order for your community to make progress related to this goal?
Oh, and I haven't even told you this yet, that I had to. If he is destructive.
Karen, I'm hearing your line. Oh, there you go. I didn't know if you were intending to speak or not. So I do have a question. This is going to be a direct question that relates to those cross-cutting factors of transportation and resource coordination. What comes to mind for you as it relates to this goal related to those cross-cutting factors? Are you seeing any issues or challenges that relate to transportation or related to resource coordination? If so, what might need to happen to address those gaps? Awesome. I see recognizing substance. So people who use substances and referring. I see sharing the steps to get help with the community. So is there a sense that for folks that need resources that they have a difficult time understanding what's available?
Yes, we see that a lot. For example, we were working with one person and it took us almost 4 days to be able to find a place that could accept somebody. I think if it was more knowledge on where and how and what steps to go through. I mean, we work with Fort County, we've worked with PFH, We've worked with Vallejo and Topeka, and Girard in Pittsburgh, but trying to get someone there faster. When you talk about volunteering to go in, if they made that decision to go, that decision is only there for a short time. And if anything comes across, they're going to change their mind and then you lose them. So if there's a faster processing, that would be very helpful.
Thank you, Ivy. Yeah. I added another sticky note. I'll attach it to the one sharing steps to get help. So clarifying and communicating available resources. I see reduced stigma. So seeing a little bit there. Where does that show up most, or what are you most interested in seeing work around stigma? Is that all community members? Is that schools? You know, what might that look like? Feel free to type that in the sticky note. So just a little bit more info on reduced stigma. What might that look like? Who's the population of focus here? I'm seeing increased use of Unite Us for closed loop behavioral health referrals. Thanks for that. I mentioned transportation, not trying to force a note here, but just a reminder that we do want to hear your ideas about transportation and resource coordination. Yasmin, I see your note. I'll go ahead and add that to a sticky. Thank you for that. Who would be our first call if there is a volunteer? Okay, yeah, good. Thanks, Yasmin. Second on, okay. So Steve is thumbs upping Unite Us. Thanks, Steve. What else is shown up here? Yeah, looks good. Okay. So recognizing people who use drugs and referring is the other one there. Okay, good. Great stuff. If you have other thoughts, drop those in the chat. Let's move on. Next question. So think about who's in the room now. Think about who is usually involved in conversations like this. Jot their names down, but also who's still missing. Who else needs to be involved in discussions around this priority, specifically this goal around treatment and recovery services for you to be successful? Who needs to be involved? Law enforcement and corrections and faith-based leaders. Good stuff. Who else? Judge St. Peter. What is it about Judge St. Peter? I see treatment centers. What makes Judge St. Peter a partner that needs to be at the table? Drug court. Thanks, Yasmin. Somebody's got that long list going on the left, so some new ideas there. Private companies who have employees, store owners who are impacted. Yeah. And mental health professionals. Yeah, thanks for adding that. That was mentioned in our earlier conversation as well. Who else? Let's pause here for about one more minute. Would love to hear, specific names. Are there, grassroots organizations in the community, individuals that come to mind that are, champions for treatment and recovery? Steve, question in the chat from Jasmine. Is this access for juveniles as well as adults? Remind me where the conversation's at on that.
Access to which, are you talking about drug court? Or are you talking about services?
I think more broadly, treatment and recovery services.
Yeah, most programs offer services to adolescents. We certainly do. 13 and older is typically the cutoff. And sometimes if it's a family issue, there are programs for, single moms or women in treatment where they can take their children to treatment. There are some of those around the state as well. In community corrections, juvenile services does have referral opportunities for adolescents as well. I'm not saying that we're over serving or that there's a ton of capacity, but there are services that exist. There's always room to improve and grow.
Thanks, Steve. Yasmin, does that help? Thanks. Yeah. See another specific name related to Director of Keeping ICT Safe. Yeah. Thanks, Yasmin. Hope that clarification helps. Finally, let's jump to the final question here. So as we think about this goal, make substance use treatment and recovery services easier to access, what do we still need to learn? That's our final question here. What's been missing from this conversation so far that hasn't been addressed? We'll pause here for a minute or two. If you've got ideas, come off mute, use the chat, or grab a sticky note. How can we better serve or reach the homeless community struggling with substance abuse? Thank you for that. We'll just hold the space for about another 30 seconds. If there's other ideas you'd like to add to this final question, please do that. What do we still need to learn? As we think about some of the topics that have come up, medication assisted treatment, we've talked about stigma came up earlier. And of course, different data that describes kind of the scope of various, use issues in the community. Anything in particular come to mind for you? Are any of those topics foreign? Would you or others in the community possibly need more information about those types of interventions or those conditions? Okay, very good. Well, hey, what I'm going to do now, I'm actually going to go ahead and grab the whiteboard for goal number 2. So that's up right now. And while we go to a 5-minute break, I'm actually going to go ahead and leave this whiteboard live. So if you are interested in remaining at your desk and doing some work, you're welcome to do that. I don't expect it though, but you're welcome to go ahead and continue some work on the next whiteboard. And this relates to strengthen community support for people in recovery. And so we're going to go ahead and take a 5-minute break. We'll come back at 2:03 and pick up this discussion. And again, I'll go ahead and leave the whiteboard open if you are interested in doing some work, but we'll see you back here at 2:03. All right, we'll get started in just about a minute. Okay, let's go ahead and get ready to get started here. We're moving on to goal 2. So we'll get ready for that. All right, I've got 203. Let's go ahead and jump back in. For this discussion, we've got one goal, one objective, and a couple of strategies mapped out, much narrower focused conversation. So what we're going to do is just open up the discussion to all 4 questions now. So you're welcome to grab a sticky note, jot down ideas. Would love it if you'd come off mute, bring some energy and your voice to this discussion, and let's dig in. So as a reminder, this goal area has been mapped out. We've got some initial ideas about the work that will be included. The purpose of this conversation is to bring in additional input and ideas from your perspective to really strengthen work in this area. So strengthen community support for people in recovery. What's happening now? What still needs to happen? Who needs to be involved? What do we still need to know? Or what do we still need to learn?
Hi, can you put the goal up on the screen so we
Yeah.
can see it?
Yeah, hold on one second. I think I ran into that issue last time. Let me reshare. So we're definitely all looking at the same whiteboard. I apologize for that. Thanks, Sarah, for mentioning it. Are you seeing strengthened community support for people in recovery now?
Yes, thank
Okay.
you.
Yeah, sorry, Sarah. Thank you. Steve, I've got what I believe is a stupid question, but it probably just comes from my lack of awareness about this type of work. But could you describe what's the difference between support for people in recovery, and I imagine that's active recovery, and then substance use treatment and recovery services? How would you describe the difference? Like how are we differentiating goal 1 from goal 2?
I think that treatment, people access to treatment and care is typically going to be provided by a licensed individual or organization who has trained providers, either on the medical or counseling or case management, peer services side. There's going to be some sort of structure to that would allow someone to provide that care and reimburse for insurance or private fees or commercial or whatever. On the community support, I think of that more of those naturally occurring type supports or ancillary type supports that can help the community. So transportation resources, housing resources, support groups such as AA, NA, or a Celebrate Recovery, smart groups that are supportive in nature, like they're self-governed, self-driven, but they aren't necessarily designated treatment for that condition. And the other one would be like a Oxford House, which is a sober living model, which is independent. It's not necessarily a treatment activity where there's licensed providers in the home, but there's some structure to it to help people be more successful. Does that make sense?
Yeah, it does. Thanks, Steve.
Bet.
On that line of thought, can you explain further the first strategy? I'm not sure. Advocate for opportunities.
So the strategy 1, advocate for opportunities to provide funding and care for the uninsured. And so that had to do with, I think, advocating for additional funds to benefit people in the community.
And then along that line with the activities, the block grant, is that something Ford County has?
Yes, we do. And I believe Preferred Family Health has block grant beds available.
Okay.
And if not, we can, there's a statewide network of inpatient facilities that accept, someone mentioned ACT in Girard. There's other couple options out in Western Kansas and Wichita area. So we could be kind of actually anyone that is licensed to provide alcohol and drug treatment, SUD treatment in Kansas should be able to do an assessment and refer to those facilities. They're kind of the gateway to those services, or they can do direct referrals too.
Thanks, Steve.
I will say this, there's not enough block grant funding to go around though. I mean, there's definitely a shortage. There's always a waiting list, a couple weeks typically. So that doesn't give you a lot of time, to get someone to strike while the iron's hot. I take that back. It's too much time. There's too big of a window sometimes if you don't have, community supports while they're waiting to get into that care. So that could be another area of, what can we do as a community to help stabilize the situation until they're able to get help. That's something that we talk about a lot.
What would that look like, Steve? What would those community supports look like to stabilize the situation till they can get help?
Well, some facilities, and I believe Preferred does this, provide social detox services, which would be usually a 24 to 72 hour stay to where someone can be outside of an environment. There are occasions when someone needs a full medical assessment, particularly when we're talking about alcohol withdrawals, where they might need an inpatient facility. There's very few organizations that do that still, unless there's a primary care physician who's able to sign off and admit someone to a local hospital. That occasionally happens, not all that frequently. So those are both options. There are some intermediate levels of kind of in between levels of services that are not quite, they're still outpatient, but they provide more structure for people to have inpatient or check-ins with nurses and providers while they're coming off of a substance. Opiates and alcohol are usually the number one kind of withdrawal concerns we're into. Alcohol withdrawal can be really dangerous, so it's important to have some medical oversight if someone has a history of seizures, tremors, and those sorts of problems. Sometimes it might be, though, as simple as providing a place for someone to live. Let's say someone's in a relationship and one of the partners is using and creating an unsafe environment. Sometimes it's a space for someone to go just to be free of that, even for a week or two in a safe house type environment. Where someone can access care and get into other services and or get into a more structured facility. Sometimes that's a need that comes up pretty regularly.
Thanks, Steve. Yeah, I see an idea. Hold a celebratory event for those that are in recovery. Yeah, seen that pop up a lot lately. Thanks for adding that to the discussion.
September is recovery month. That is a great time to sell. We always hold an event in our major locations, including Cowley. We would love to see more partners in that in the future. So that's an opportunity.
Thanks, Steve.
Steve, I know Ford County Mental Health had a booth at the Cali Pride event last year, which I think is great, but maybe something, expanded in conjunction with that as well.
Yes, thank you.
Yasmin mentioned in an earlier discussion on the hospital ER and the challenges presented when, I'm guessing what's going on here is someone's using kind of the ER when they're having a drug-related event. So are you suggesting maybe, Yasmin, that what's needed is some way to help alleviate that burden on the ER? Okay, thanks, Yasmin. So any specific ideas, feel free to drop those in the what needs to happen. Steve or others, are there any promising practices or other communities doing similar interventions that you're familiar with?
There are several models out there. Probably the most successful one that I'm aware of in the region is the partnership between ComCare in Sedgwick County and SACK South. I can't think what that is. We'll call it SAC RADAC, which is kind of the regional alcohol and drug treatment, which is another partner that should probably be at this conversation. But they have a shared crisis stabilization unit that has both detox and mental health 23-hour stabilization services available. And those can be a nice relief to the ER. It's a problem with every community and a reason. The problem is with Cowley County and some of the counties we serve is just the volume of people you need in order to keep a space like that open. There's probably enough in the county, but there's really not enough in either major community to keep the doors open. So where do you have it? And then if it's out in the middle, how do you get people there? Those kind of the conversations that often come up around those sorts of facilities.
Okay, I'm really going to show my lack of knowledge here, but I know that both hospitals offer pre-employment drug screening services. I'm just curious if there is an opportunity to provide like a referral, if someone does pop on a drug screen, referring to community resources. And if there's any patient privacy violations associated with that. I don't know. It's just an idea I had.
Good idea. I mean, certainly they have to consent, so it'd have to be a permission and consent process. The same thing with, it's like some primary care physicians will do alcohol screening questions and maybe even intervene during those conversations. But the individual, there has to be consent and willingness to take that next step. But I think improving our referral network has already been addressed across lots of different, but that whole screening, where else can we catch people when they're in need? WIC, Medicaid programs, or other possibilities. I mean, there's probably lots of places like that.
Yeah, thanks, Sarah, for the question. Steve, for the context and info. Who needs to be involved? I dropped SAC and Sedgwick ComCare as an example. I see somebody mentioned WIC, Women, Infant, and Children Program. Is that housed at the Cowley County Health Department? Maybe so. Was just curious.
I assume so. I should know that, but I don't. Usually that's where it takes place, or if it's not at the health department, the health department helps facilitate it or participate as a partner. Usually,
yeah,
or other counties.
It is. Can you hear me? Am I coming through?
Sure can.
Okay. I'm Daniel with the Cowley County Health Department, and WIC is indeed one of our programs that we administer.
Okay. I think that came up in the context of screening for alcohol or drug use, substance use, harmful substance use, Steve, as Steve would say. I'm going to have to write that one down and explore that context more later. So let's jump to these final two questions. Who needs to be involved? And then what do we still need to learn? So what questions do you still have? What hasn't been mentioned yet that needs to be out there in this discussion? We heard in our last discussion, community health workers, treatment providers, churches, law enforcement. So we'll assume some of those same partners still need to be involved. Any other unique partners or perspectives related to support for people in recovery? Does your county have a prevention coalition? Is that built in within Rise Cowley or within Legacy or some other group? Like a KDAD's funded prevention coalition, I guess is what I'm thinking of. Okay, thanks, Yasmin. We'll leave these questions open for just about another minute, and then we'll jump to that final goal area. And that focuses on schools. So kind of a bit of a shift in our thinking to a more specific population of focus. In the chat, yeah, that was Yasmin. Thanks, Yasmin. All right, I'm gonna undo the screen share here for just a second. Well, thanks, Yasmin. I'm gonna capture that final thought from the chat. Now I will undo my screen share. Okay, so real quick, just want to do a quick frame around goal 3. This is in the action plan that we shared. So we're shifting to this final discussion on our third goal. From there, we're going to shift to metrics and then implementation and monitoring, which those last 2 discussions will probably go pretty fast, about 5 minutes each. And then we want to spend 10 to 15 here on goal 3. So when we talk about increased substance use prevention efforts in schools, the first objective related to decrease substance use in schools. And then there were a number of specific strategies that were called out in this draft plan. Expand training for school staff, expand school-based education, strengthen partnerships between schools and other organizations to create coordinated responses, and then the MHIT grant for youth in need. Mental health intervention training, is that right? MHIT?
Teams.
Oh, mental health intervention teams. Okay, thank you. So when we talk about this goal 3, those are some of the ideas that have come up so far. So what we have the opportunity to do now is to just really expand our thinking, build some additional context, bring in some new ideas from those of you that are with us today. So I'm going to go ahead and bring up the whiteboard for goal 3. And let's dig in.
Hey, Ty, can I throw out maybe one more thing to consider in this?
Absolutely, yeah.
A lot of times when we talk about prevention and intervention, early intervention, the focus is often what do we do to reduce usage and stop, a certain substance or reduce access, but also where should we be pointing youth and families towards instead of that? Because in this field, recovery is never just about not using, right? It's what can we do? What's available instead of those? What can we offer as a community as an alternative to good things that are going to keep you away from that? So I think that's an important question to consider in this conversation.
Thanks, Steve. Yeah, I've got that captured in what's happening now, but I think I'll shift it over to what needs to happen. Good point, though. Thank you. So good chance to hear from some of our folks that serve students, people in the school district, those that partner with the school district, those that serve youth and adolescents. What's happening now related to substance use prevention in schools? What are some shining stars or what's working? What's happening but needs additional attention or support? I want to say that I've heard from Sarah or Yasmin or Allie that possibly there was some work related to substance use prevention in schools happening. Is it through Pathways? I might be making that up.
One of the 5 areas of focus in the Pathways 3 grant that was received from Blue Cross Blue Shield for Rise Cowley focused on prevention efforts. Also specifically around updating policy and making the like changes a little bit more educational and less punitive. So providing some, education resources to students and parents as well.
Thanks,
And
Sarah.
my other Rise Cowley cohorts, please correct me if I'm wrong.
Yeah, Yasmin says that's correct. Thank you. And then we see DARE program for 5th graders as what's happening now. All right, what needs to happen? And again, we've got expand school-based education as a strategy, but what types of education? Anything come to mind for you? What type of partnerships are needed? What would it look like to prioritize other districts or buildings related to mental health intervention teams? Yasmin, Hope Squads, that's a thing that's happening now or something that needs to happen? Thank you, Yasmin. I think let's open it up to what needs, or I'm sorry, who needs to be involved as well. I think when the group said that the plan as written resonated with them, they weren't lying. We're not seeing a ton of additional what needs to happen ideas. Do any other partners or individuals come to mind? Would love to hear names of any specific people. These might be champions in specific buildings, champions in specific school districts. Thanks, Yasmin. Okay. Like that. Yasmin, I'll drop your comment in the chat. Connecting to libraries, rec centers to offer access and awareness to alternative programs. Who's Eric Burr?
He's a chief at Arc City PD.
Okay.
No, Eric's not
He
with.
was the one that was unable to attend today and
Yeah.
requested the recording.
I should say former chief. Tom
Yeah.
Erickson. I take that back. Sorry.
Yeah, I was gonna say he's not with PD. He is now with USD 470.
Okay.
And his area of focus is this type of prevention, substance use prevention, in the primarily middle school and high school.
Thanks, Tom. I see another idea, guest speakers in schools with knowledge about substance use prevention. Thanks for that. I captured those in the wrong one. I'm sorry. But I'll get them moved over. Very good. Thanks for these ideas. I'm just going to zoom out, make sure we're not missing anything. All right. And yeah, who needs to be involved? What do we still need to learn? Keep these ideas coming. Really appreciate it. Thanks, Yasmin, for that. Okay. Thanks, Steve. I'm going to download that just to make sure that it's front of mind. So that's the KCTC data at the bottom of that CCBHC needs assessment.
Yeah, it's our just general Cowley County needs assessment template that we did for all the counties, but there's specific information on school use from the KCTC survey at the bottom, if you scroll down.
Perfect. Thank you. Board members. Yeah, very good. That's true. What do we still need to learn? How addiction works in families and strategies to identify those most at risk. So I'm hearing you say, thinking about more of a prioritizing those most at need while we're also doing community-wide work. Very good. Thank you. All right, I'll leave this open for about another 30 seconds and we'll shift to metrics. Right, thanks so much for these ideas. Like I said, this is the third of 4 CHIP priority meetings, and I have gathered some really fantastic feedback and ideas from folks that have shown up. Food and nutrition was our blowout meeting. Everybody loves food and nutrition. I think we had 40 plus folks on, and then with healthcare access and today, somewhere between 15 and 20 individuals. With housing, I'd anticipate about the same size group, but even with a smaller group, you all brought some new ideas, asked some really great questions, mentioned some feedback that will definitely be impacting the action plans as written. So thanks for that. Diana, I'm seeing one final comment from Yasmin. I can move that into the whiteboard because I know you're going to bring it. Oh, go ahead.
I did it already.
Thank you. Appreciate that. Well, let's shift gears. We've got 2 more discussions that we want to have today. I mentioned before we wanted to talk metrics. And so Diana will capture notes as we get some ideas from you all. So again, when we think about our CHIP action plan, we've got goals, we've got objectives, strategies, and activities. We also want to get a clear sense of how will we know if we've made any progress. And so we want to shift to a conversation on metrics. So there's one discussion question on the screen now. Shout out what's on your mind. It doesn't have to be perfect. We just want to get some broad feedback from you. So when it comes to the work in this priority area, substance use and misuse, how will we know if we've made progress? What comes to mind for you when you hear that question?
Decrease in number of ED related visits.
Decrease in ED related visits. Thanks, Brian. Is that a metric that's tracked now? I assume it is, but like drug related ED visits?
I mean, we track the number of visits. I don't know that we necessarily track the number of drug related ED visits, but I can see if we can get some of that information.
I'm just thinking that if, there's some focused effort at the strategy activity level where you hope to see a decrease in drug-related ED visits because maybe you start to implement some strategies to alleviate that, would you be able to measure that change? And it sounds like you probably would.
Yeah, we need to set a baseline to know kind of where we're at to be able to judge how effective everything is.
Yeah. Thanks, Brian.
And I would add to that there is a metric on mental health related ED visits. And my assumption is that some ERs just loop their SUD related issues into that. I actually have that information in front of us. Cowley County is at a 2.7 rate, which is kind of right in the middle of the 5 counties we serve. So it's not the highest, not the lowest. But that could be someone with a non-substance, like someone who comes in who's having thoughts of suicide or depression or schizophrenia. So it may not be the most specific measure that we have available.
All right, thanks, all good stuff. So what else comes to mind when we think about possible measures related to this work? I heard a lot of different, we heard about stigma. One way that we've been able to get a sense of that, we just did a opioid community needs assessment survey in Saline County, and just asking public perceptions around stigma was really telling there. So we had about 500 people respond to a survey providing feedback about stigma. So possibly community perception might be a metric for an idea like stigma.
One of the factors that is tracked or pulled into the community health needs assessment is excessive drinking, what percent of, and also adult smoking. So if we're looking at trends, we have that information from county health rankings and Kansas Health Matters going back. I know it's not specifically illegal drugs, but it is substance use. We also have a metric, alcohol impaired driving deaths, that we have been tracking as well.
We haven't had much discussion specifically about like drunk driving. Is that a strategy or an activity area where we'd want to see some attention in the action plan?
I guess it depends on if the people here in this room think that it is a problem.
Yeah, I'm just asking because if it's a measure, that's helpful. But if we're not doing work toward that measure, then maybe we wouldn't need it. I'm just trying to get a sense of whether you or others were signaling that we need to have some focus on that.
I haven't heard. I was just trying to look for
Okay.
metrics that we're already using related to substance abuse.
Perfect. Brainstorming. I appreciate that. Thanks, Sarah.
We would anticipate doing anywhere from 80 to 100 diversionary evaluations for people who've been arrested for drunk driving and need an assessment in just in Cowley County.
In 1 year?
Yeah.
Wow.
Do you have to double check that number, but I'm pretty sure that's pretty close. One of the providers that has done that historically is retired, and we're looking into doing that work, and I think that's the number that was given to us.
Okay. Question that always comes to mind for me is that Cowley County residents? Because when you look at county health rankings data, for example, you'll see traffic fatalities in communities where I-70 goes through. A lot of times that's not necessarily their community members, it's people passing through. So when I see a number like that, I wonder, how many of those are people passing through or, residents, but.
Yes, because typically those individuals who were from out of the region will get that from their local area most of the time.
Okay. Well, final thoughts here. How else will we know if we made progress? Thinking about the 3 different goal areas, access to treatment and services, supporting those in recovery, and then support in schools. Any other measures come to mind?
I don't know, like our high school has like the vape detectors they put in their bathrooms because it was like a thing that was almost a daily incident that it would go off. So I don't know if they measure like how often it goes off or when it goes off, but I think measuring how often that is could maybe help.
Thanks, Lacey.
How about measuring the number of referrals to the treatment recovery programs from our community?
Yeah. I can't hear whoever's coming through Lacey's line. You might just get closer to the mic.
It's just outside noise, sorry.
Oh, I'm sorry. I thought somebody was adding. Brian, that caused me to think too about, Steve mentioned before the idea of voluntary versus involuntary treatment as a possible measure. Steve, is that something you said that's measured now?
Yes, both referrals. Referrals are kind of tricky, like what constitutes a referral. That's why Unite Us or something like that would be so helpful. Someone may call and say, I'm interested, but never actually, or I want to refer this person, but never, actually, they never actually come in. So, but certainly voluntary versus involuntary admission should be trackable by most providers.
All right, thanks, Steve. Any final thoughts before we move to implementation and monitoring? All right, well, definitely some good measures to pick from. I'm sure some others exist. And as we continue to refine the action plan, we'll identify the best ones we can come up with. Y'all have a chance to review, provide feedback on that, at least at the community meeting. Let's go ahead and move to implementation and monitoring. And Diana, there's 3 questions, and I ended up putting them all next to each other so folks can see those at the same time. And would love to hear your thoughts on this. So again, we spoke to the idea of pretty soon shifting from CHIP planning into CHIP implementation and monitoring. And we know that the landscape in the community is different between the different priority areas. There's different partners, coalitions and committees focused on food and nutrition compared to those individuals, coalitions, et cetera, focused on housing or substance use and substance misuse. So we wanted to check in with stakeholders for each group. Want to get your thoughts on these questions. So when you think about CHIP plan implementation and monitoring, how often should we check in on progress? How often should key stakeholders involved in specific CHIP action plan work check in on progress? When you think about the type of organization and coordination that's needed, do you feel like there's a pretty strong group of organizations involved? Or do you feel like there might be new coalitions or committees or action teams needed to support this work? And then the final question relates to what's the best way to keep all partners, this includes the broader community as well, informed about progress and updates. So would love it if you'd provide some feedback to us to help inform implementation and monitoring related to this priority. I'll tell you, Sarah with William Newton Hospital, who's one of the key organizational partners in this work, has mentioned that William Newton Hospital will at least annually be publishing a written report that would map out some of the successes as well as some of the challenges related to CHIP implementation. So at minimum, I know we can count on at least an annual update. That would be more for question 3, Diana, by the way. Sorry, I should have said that. As far as work kind of at the tactical level, so when you think about implementing some of the strategies and action steps, how often should groups check in? I think what we've heard so far from most of the committees is, let's check in about, no more frequently or less frequently than monthly. Because if we don't check in regularly, this work has a way of kind of slipping away. Does that resonate with you all, or is some other frequency more appropriate for this kind of work? And I'll ask a more specific question related to the second question here. Do we need any new coalitions, committees, or action teams? At this point, and I'll pick on Steve and Sarah and maybe Yasmin, just kind of knowing your roles with some of the coalitions and committees in the community, where would this work fit right now? Are there groups coming together now around substance use, misuse, or prevention?
Yeah, I would say definitely the Cowley Acts Health Group is already working around the specific, task of substance use and misuse in schools. So that would be one, one way to keep track, but on the, from a priority level, I'm not sure.
You're thinking Cowley acts with one of those committees would likely be a place for some of this discussion.
For for some of the strategies,
Mhm.
and everyone else chime in. I just don't know about the larger priority of substance use and misuse and all of the, all of the goals.
Thanks, Yadira, for the comment in the chat. Yeah, I can just tell you from, being involved in community health improvement planning in all different types of communities. I used to coordinate this work at Sedgwick County, was involved in Johnson County, and then have worked in a consultative role in many, many others, is that the idea of an anchor institution really makes a lot of sense. Having that it person, that it organization who knows that they're primarily responsible for supporting partners, and some level of accountability to keep the work moving forward. That makes a lot of sense. And that tends to be a common denominator for communities that make long-term progress in work like this. And so I'm just thinking, in your community, is there a natural fit right now? It sounds like maybe Cowley acts as it. If not, what are some other coalitions or committees that might be able to take on that leadership or a leadership role in spurring this work forward? Thanks, Yasmin. I think you just spoke exactly to what I was rambling about just now. Thank you for that. Yeah, a cross-sector discussion, I think that includes many of the organizations and folks like on today's call would be necessary. No less than quarterly, I think, and maybe more frequently in year one as you're really starting to build a foundation for this work.
Steve, could this be like a follow-up discussion for our community meeting? Just to get some ideas if, the greater group feels like there is a need for some type of, specific coalition,
Yeah, I was kind of thinking about that. There are other groups that address substance use, but it's not the sole focus, right? So there's been a couple, like there's a really good group that met around crisis behavioral health actions that I don't know if they're still meeting, but David and I used to attend that, and then I think COVID hit and things got a little bit unwound there. But there have been groups that have touched on it. There are groups that address it through youth. I think of some of the meetings with foster care and juvenile services that were certainly where it comes up. But as far as substance use being the sole focus, not so much. There's also like suicide prevention efforts, which substance use comes into that, but it's not the sole focus. So I can't think of one that just kind of has that at the front and center, but substance use is not always a front and center reason why people use. So there might be another larger group out there, but I don't have one off the top of my head. Maybe we should wait a little bit. I'm not sure.
well, and especially since there are a couple of people that have been brought up today that weren't able to attend this meeting, maybe we could bring them into the discussion.
Yeah, for sure. Yeah, good thoughts. Thanks, Sarah. Thanks, Steve. All right, I think that probably is a good place to stop on the implementation and monitoring discussion. So thanks for all the ideas and input there. That's all we've got for today, besides just a quick reminder. You've probably seen the Cowley Chip flyer floating around your email inbox. If you've got a copy of that, you'll know that we've got one additional CHIP priority meeting that happens tomorrow, as well as at the end of the month, there are 2 different community meetings, one on the 24th and one on the 25th. And so definitely mark your calendars for those upcoming events. I will drop that flyer in the chat one more time right now, just so you've got access to that. And I believe all of the links are clickable for the Zoom. There's no link right now for the community meetings coming up later this month. I believe in the next couple of days, a registration link will come out where you'll be able to RSVP for those sessions in Arc City and the other in Winfield. I just want to thank you for being here today, working through the goals with us, providing additional input and ideas. Your time's much appreciated. Any final thoughts from the CHIP planning team, Steve, Sarah, Tom, if you're still on?
No, I just appreciate participation, and I really like the direction of this conversation. I'm excited to see it getting attention. It's so important, so I appreciate it.
All right, have a great rest of your day. See you soon. Take care. Diana, it's probably going to make you a... Oh, when you leave, Diana, it'll make me co-host, and then I can take care of business on the recording. So I'll handle that. Thanks, Diana. Hey, Yasmin, I was going to ask if you wanted to just stick around. Let me turn the recording off, though.
Sure.